location, finances, and also flexibility. I knew for a fact I wanted to work while in grad school because, people have bills to pay. And so I made sure that I categorized the schools based off if they met my needs. And Mount Sinai definitely met my needs. I looked at the concentration, look at the program competency. What am I going to gain out of this program? How long is the program for? What do they offer within the program? And I knew for a fact, like health promotion and disease prevention, I didn't hesitate to concentrate in it because it's not that I don't like epi, it's not that I don't like biostat. I just think health promotion and disease prevention fits my needs. And they fit what I'm looking for and what I would like to do eventually after I get my MPH.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 46. Hi everyone, Omari Richards here. Thank you all so much for joining me. Before we get into the show or anything, please just review the show. Leave a like if you're on YouTube. Subscribe to the show, and I appreciate you all. It definitely helps me get the show in front of more people. I'm definitely just trying to share more public health stories, help people navigate their careers, their paths, their journeys. So I appreciate you all there. Today's episode is a great one. It's one that I've been waiting on to do for a while. If you're interested in the Public Health Associates program, PHAP program, this episode is going to be great for you. This person in this episode is going to be a great connection. So definitely reach out to her. So yeah, without further ado, here's today's episode. Enjoy. Today, we have an experienced clinical research coordinator with a demonstrated history of working in the hospital and healthcare industry. She did her bachelor's at Caldwell University in public health education and promotion, then went on to pursue her master's of public health in health promotion and disease prevention from Icahn School of Medicine at Mount Sinai in 2019. During her public health schooling, she had various roles such as clinical research coordinator, health promotions health coordinator, as well as a research assistant, to name a few. She is currently a public health advisor at the Centers for Disease Control and Prevention in Greater Hartford, Connecticut, I believe.
I am assigned to, I work in Hartford. Yes, that's my assignment. Yes.
Awesome. We have Naissa Piverger, MPH. Welcome to the show.
Thank you, Mari.
Yeah, it's my pleasure. Naissa is someone who's very difficult to track down. We've been trying to schedule a podcast for probably, I want to say, at least 6 months now, but alas, she's on the podcast, and I'm happy to have you here.
Thank you so much. Appreciate it.
Yeah. So how are you doing, and how have you been coping? I know that you've been moving around a lot during these late times.
Yeah, it's my I'm not gonna lie, when COVID first started, my mental health deteriorated a lot. So I was not practicing self-care. I just wanted to, do what I needed to do as far as my assignment with the Connecticut Department of Public Health. But now that the vaccine came out, I have a little bit more time to relax, a little bit more time to breathe. And I've been in touch, with family member, friends, just catching up and checking in on everyone and vice versa. So it's been well. Thanks for asking.
Okay, I'm glad to hear that. So tell us a little bit about your personal background.
So my personal background is I came to the United States when I was 6 years old from Haiti. And at the age of 6 up until the age of 12, I was homeschooled for a little bit. My father taught me all the languages and math, social studies, you name it, all the subjects in the world. Because, as someone who came from a different country, learning English was a little bit difficult for me. And ESL should have helped me, but there was an issue with that. And my father took the initiative to kind of teach me everything that I needed to know. And so right now, I lived in New Jersey for a while before I moved to Connecticut and got my assignment with CDC. Other personal things. I don't know. I'm a very social person. I love outdoor activities. When I'm not working on COVID stuff, I like hiking a lot. I like taking pictures of landscapes, and just kind of, calming down a little bit, doing the things that I would have liked to do before COVID started, or yeah.
Okay. And any hikes that you recommend people take?
There are a lot of hiking spots in Connecticut. I feel like the list goes on and on. I'm actually looking to venture off to different states like Maine, Utah, Colorado. Um, but it's a lot. And at the end of this, people can connect with me. We could be hiking buddies.
Yeah, awesome, awesome. And I love how you went from Maine to Colorado and Utah. That's like completely different sides of the country, but I'm digging it. I'm digging it. So just to note how long it's been taken to schedule Naissa. I didn't have the question asking about how do you identify, and that's a question that I added
Oh,
a couple of months ago.
she, her, identify.
Okay, awesome. So what does public health mean to you?
So public health to me means just improving the health of people in their communities. And I think public health is so broad that we all see public health as such a broad field that it doesn't matter which area or which sector of public health you work in, you can definitely make a difference. My background is in maternal and child health. So when I was in grad school, which we will get to this question later on, I did my research on maternal and child health, and I learned so much because I've never had a background in MCH before. Never did I have a background in infectious disease. So I think to me, it's just whether it's implementing a program, doing a research on a disease, or just listening to other people and listening to the community, and also just kind of detecting health related issues and doing case investigations. I think all in all, it narrows down to just improving the health and lives of the community that you want to serve. And that's what it means to me.
Yeah, I like that. I like that. And going back, how many languages do you speak?
I speak two languages. Well,
Okay,
three if you include English, French, Creole, and English.
okay, okay, awesome. So before you got your bachelor's, you were a volunteer at the soup kitchen. So
Yes.
was this a part of like high school, or how did you get involved in this?
This was definitely a part of high school. I think it was actually a requirement,
Okay.
because in high school I would just do homework and go home. And then I think it was a requirement to volunteer to soup kitchen, and it was really like the preliminary introduction to public health for me because I dealt with the homeless population and also those who lived in the area but were less fortunate. So a lot of the things that I did as part of being in high school and volunteering at the soup kitchen, I would prepare meals. I would serve them, and also, I would also help clean up afterwards. But to me, the thing that stood out to me volunteering at the soup kitchen was networking and building relationships with people inside the community,
Mhm.
because you would often see them every single time. So it's like they already know you're there before they're actually there. So
Mhm.
I really enjoyed the networking and building relationships with the community itself.
Yeah, and that's really cool that you got to do that and like just realize how impactful and how much learning that you can do with that
Yeah.
experience, especially in high school and whatnot. So did you get the word for public health while you were there, or like in high school? Like okay, so
Not at all. I
okay,
learned
tell
about
me about that.
my first introduction to public health was in college.
Mhm.
So originally, before I switched from public health, I was a nursing major in college, in
Mhm.
undergrad, and I switched from nursing to public health for one reason, and that one reason was I felt that nursing was very robotic. I like variety. I like to get my hands involved in many different tasks, many different activities, and I felt going inside a patient's room and just taking their vitals and documenting it and doing the same thing repeatedly was not for me, which is why I made that switch. And it was the best decision I've made in my life. I do not regret, switching to public health. And I really think that by making that switch, I really learned to build my own person, like my own character, and subsequently develop the skills that I needed to get me to where I am right now.
Okay, and it's interesting you say that because I know a lot of people go from wanting to do their bachelor's in public health, do their master's in public health, and then become a nurse. So, and
Yeah.
I'm glad that I guess you realized that early on that it wasn't for you. But going into college, like why did you want to become a nurse going into college?
So my parents, Caribbean parents, it's like doctor, engineer, lawyer are literally the holy grail of diseases, the holy grail of majors. And so for me, my parents really at a young age reinforced that I needed to be someone in the medical field, whether it's a nurse or a doctor or PA, whatever it is. I just needed to be in a clinical team seeing patients, diagnosing people, whatever the case may be. And for me, it's like being a child of immigrant parents, it's like they put that pressure on you at such an early age and you don't want to disappoint them. And so for me, I was a nursing major for probably 3 years, I would say. Then I made that switch. And oh, man, the backlash I got from them when I made that switch, it was unbelievable. But now they're starting to understand the importance of public health. And I've been able to explain that to them in many ways and many times. And they finally got the hang of it. And really, I would say the reason I was a nursing major in college was mostly because of my parents. I actually didn't get the chance to pick my own major or figure out what I like. But subsequently, leaving nursing and then just getting into public health, it worked out. I'm still in the healthcare field, but they're proud of that. So that's good.
Yeah, that is awesome, and it definitely does it is a challenging thing to do, like considering that you waited 3 years to make that switch and do it. But I'm happy that you did. I'm happy that you're happy. That's the most important thing.
Thank you.
And public health is a great place to be. So
Absolutely.
yeah.
Absolutely.
So was it that you were doing a nursing major and you realized that there's this other major called public health education and promotion, or how did that work out?
So the program public health education was fairly new. That was my first introduction. When I made the switch to public health, I did a little bit of research on it. I was just like, well, never heard of this before. What is it? And there were other programs that were also trying to develop a public health major. Then Caldwell developed their own public health program. And I really liked the concept of it, working with communities, different types of communities, doing different types of research. And working with different types of stakeholders. You're not necessarily working with people who only work in the public health field. You're working with people who work in marketing, business, all that, every other field, which I liked. And so when I learned about it, did my research, I switched. And thankfully, all of my nursing credits transferred over. So I didn't have to retake any classes, and I got to graduate on time, which was great. But I do have to say, we were one of the first cohorts in the public health program. We took all the classes, nutrition, epidemiology, public health surveillance, etc. So that's how I learned about it. It was fairly new, but I enjoyed it.
Okay. That's awesome. And then you're also the vice president of the student org of public health education. So how did that come about? And then what were your responsibilities in that role?
Or serving as the vice president of the public health education program. Basically what it was networking with different schools within the area, and also bringing in public health speakers to come in. And basically, how every month has their own health awareness day. So breast cancer, prostate cancer, we would do different fundraisers, different activities, just kind of promoting, breast cancer awareness month or prostate cancer awareness month, whatever month it was, we would do an activity around that. If we couldn't do an activity, we would do a fundraiser, and that fundraiser would go to a charity, all of that. And we would also work with different nursing homes or different healthcare professionals in the area to kind of help promote that health awareness month.
Okay, that makes sense, and that's a cool position to have in undergrad. Definitely again some leadership skills, and as well as just building networks as you spoke about earlier.
Absolutely.
And you were also a recreation aide at Alaris Health during undergrad. Yes. So tell me about that.
Yeah, so working as a recreation aide, it was honestly one of the best experiences because for me, because that was my first job actually in undergrad. Well, I had a job in high school, but it was babysitting, but I considered this actually my introduction or a part of my introduction to public health. So what I was doing as a recreation aide is I was working with a lot of Alzheimer's residents in a nursing home, and my job and my responsibility was to just work with them doing different types of activities, playing games. Obviously Alzheimer's it's a tricky, illness to work with. But it was very fun. I mean, they would forget the next day what we did, but I think one of the most part is just listening to their stories. I value elderlies a lot. Like they have a lot of wisdom, and just hearing about the things that they would do with their families, I would try to incorporate what they told me, like back in the day, like when they were my age. I would try to incorporate like a little bit of coloring, a little bit of sketch, or if they have a favorite flower, I would bring a picture of that flower and they would like, scribble on it or just like try to paint it. But it was basically to help with their memory. And there were a lot of issues with that, working with Alzheimer's residents. But I enjoyed it. They really gave me the energy that I needed to work with them, and I appreciated that.
Yeah, that's awesome because you just seem very excited about that. So I'm glad
Yes.
I'm glad that you can get excited about that. That's awesome. So then you graduated from your bachelor. Well, so where is Caldwell University first of all? Is that in Connecticut?
Oh, no. Caldwell University is in New Jersey. It's in
Okay.
Caldwell, New Jersey.
Okay.
I don't know if you've heard of Montclair State or Bloomfield. Yeah, it's around that north part of
Okay.
Jersey. Yeah.
Okay. Thank you. Thank you. For anyone else who is wondering as well.
Hey, shout out to Caldwell.
Okay, so you graduated from your bachelor's at Caldwell, and then
Yeah.
you became an assistant teacher at Little Stages. So
Yeah. So
tell me about that.
yeah, so that was actually my first job before working in a nursing home. So a lot of that was really me working with kids. Um, I'm not a fan of kids, but I became a fan of kids when I started working with them and, writing up notes, assessments, just reading to them and, answering questions, just asking them basic questions like, what color is this? It was a lot of the things that I did with similar to a lot of things that I did in a nursing home, but working at Little Stages was actually my first job, which then I transitioned to working in a nursing home. But a lot of that was communicating with parents as well, providing them with reports on, how little Johnny did today. Did he get into any trouble or were there any issues, etc. So that was it. It was very short, but I enjoyed it
Yeah.
again.
And was this something like you plan to do, or how did this like come about?
It wasn't something I was just randomly looking for jobs. Like at the age of 17, you kind of want to have your own autonomy, you want to make your own money. And
Mhm.
so when I started googling random jobs, that was the thing that I got. And now that I think about it, it's so interesting working with elderlies and kids because there are some similarities.
Mhm.
However, the age is really the only difference. But I enjoyed my experience, and it's when I took one of my public health classes, looking at diseases across the lifespan. Like that's now it clicked because there are diseases that are more prominent in kids and diseases that are more prominent in adults, and it makes sense. So I think I don't want to say that all of my job experiences were a waste because they all connected up until now, if that makes sense.
Yeah, definitely makes sense. And I feel like a lot of people see the same, like building off of different positions or like
Right.
seeing that interwoven kind ofness going on. So,
Yeah.
so tell me this. So that after you or like when you were thinking about graduating with your undergrad, um, did you know that you wanted to go on and get like your master's in something? Yeah.
Absolutely. Yeah. I for sure. I actually applied to grad school like a few months before I graduated, and I got my acceptance letter a month before graduation. So that way I just transitioned from school back to school. Because, and also I didn't want to lose that momentum.
Mhm.
Because I know, some people want to take that year gap. I personally knew that I couldn't because I have certain goals I want to set out or I want to accomplish by a certain time.
Mhm.
And I made sure that I would get into grad school, whether it was before I graduated or after. And that decision of why I wanted to pursue grad school was really because of my enjoyment and my passion for public health, because I felt that undergrad taught me some things, but I feel like I could learn more. I could build on more experiences. I could get more experiences, and grad school was definitely a really good experience for me.
Okay, yeah, and that makes sense, and I don't see why not. If you seem like you seem like very excited about public health and getting into
Oh my
it.
God, such a nerd.
That is fine. That is fine. We need more nerds in the world. So you were also a writing tutor at Caldwell University, right?
Yeah. So before I graduated, writing was actually one of my it was really something I was really good at writing, to the point where my father one day thought I was going to be a writer. I was like, that's not going to get the bills paid. So then I just like did it for fun. And then I signed up to be a writing tutor at Caldwell, and it was basically, reviewing essays, whether people were in public health, they were a public health major, business major, art history major, whatever the case may be. It was very straightforward. Sometimes I would sit down with them. Sometimes, they would send me the paper via email, and then we would proofread it together if they were not able to make it in person. And then again, you learn different types of, not just skills, but you learn about different types of people, not necessarily in public health. I learned a lot about art history just by reading someone's paper that I never learned before, or a business major. So I've enjoyed every single experience that I've had so far.
Yeah, and that is awesome that you get that experience and you were able. And I feel like a lot of people might just take it and be like, oh, you got to do this, but you took it
Right.
as a learning experience to say, okay, I'm not doing business, but there's this business paper that I got to look over and do those kinds of
Right.
things. But going back a little bit before that, what kind of writing did you like to personally do?
Personally, I would write a lot of poetry.
Okay.
Very short poetry. They're a little dark, not like Edgar Allan Poe dark, but just a little bit. I don't know. At some point, I thought I was going through an emo phase. That was also another thing. But I've like whatever stuck out to me at 2 a.m., 3 a.m., I would just wake up and write it. And there's this website. I don't know if you've ever heard of it, Deviant Art. Have you heard of that?
It sounds
Yeah.
familiar.
Yeah. So basically, there was this website or WordPress. I would publish my poetry, and people would like it and share it. And I'm just like, I retired. I'm done writing. So I enjoyed my time
No,
back in the day.
but you can't be done writing. I'm trying to bring some people together to do some public health things around some writing. So I'll
Oh,
loop you in. I'll
okay.
loop you in.
Definitely. Awesome.
Yeah, awesome. So you were also a CVS pharmacy technician. Was this
Yes.
before you graduated as well?
So no, this was after I graduated. I was a pharmacy technician
Mhm.
towards the end of graduation and undergrad. And when I started my grad school, I learned about different types of medications, what it's for. And it all, when I tell you, Omari, like it all makes sense. Like there are certain medications that I knew on the top of my head. Like I was just like, oh, I know what this is for. And I was just quick. I'm a quick learner, and one of the things I appreciated about working with doctors, working with the pharmacists and the pharmacy techs is that it is a very fast-paced environment, especially when you're filling out medications. But there are just certain medications that like it makes sense, like just the breakdown of the medication word. And then there are times where I would struggle with the medication. I would ask the pharmacist, I'm like, what is this for? And then he would explain it to me. And if a customer comes and like, hey, I'm here to pick up my blood pressure medication, he doesn't even have to tell me the name. I already know which medication he's referring to. So save time. And, so I definitely enjoyed my 2-year experience working as a farm tech.
And you have to get a certification to
So
become a
you
farm
can
tech,
get it.
right?
Yes, you can get a certification. I was certified. Um, the certification comes with a little bit more pay.
Hmm.
And you can work in, different settings, like a hospital setting if you really want to.
Hmm.
But I strictly remain with CVS, just because I enjoyed it.
Okay.
I enjoy
Okay.
a lot of things. So yeah.
Okay, awesome. So then you went on to get your Master's of Public Health in Health Promotion and Disease Prevention at
Yeah.
Icahn School of Medicine at Mount Sinai.
Correct.
So tell me, when you were applying for schools in your undergrad, what were you looking for?
So I was looking for definitely location. I did not want to go too far from Jersey. I applied to schools in Jersey, Rutgers, and different other programs in public health. I know I applied to Rutgers in another school. And then I started venturing out outside of New Jersey, which is where Mount Sinai, it's in Manhattan, and also Columbia, New York Medical College, which is a little bit far up, but I prioritized the program. So location was one thing, money was a different thing. Someone has to pay these student loans. So I made sure to take that into account when I was applying to programs. And I also looked up to see how to fund my MPH, because that's something that I didn't really think about until I spoke to different students, and they were like, oh, there are certain organizations that would help fund, but unfortunately you'd have to work with those organizations for a certain amount of time for them to fund your MPH. And I did not have any experience with any of the organizations. And I knew I wanted to start my master's right away. And working and having applied to a job with the organization would have taken me a while to get in. I didn't want to defer my acceptance. So location, finances, and also flexibility. I knew for a fact I wanted to work while in grad school because, people have bills to pay. And so I made sure that I categorized the schools based off if they met my needs. And Mount Sinai definitely met my needs. I looked at the concentration, look at the program competency. What am I going to gain out of this program? How long is the program for? What do they offer within the program? And I knew for a fact, like health promotion and disease prevention, I didn't hesitate to concentrate in it, because it's not that I don't like epi, it's not that I don't like biostat. I just think health promotion and disease prevention fits my needs. And they fit what I'm looking for and what I would like to do eventually after I get my MPH. Okay. So if anyone's looking to apply to MPH programs, location, finances, and flexibility, because I could work, I work full-time and I was a full-time student in my grad school. So, and I had a very, very flexible mentor and boss who allowed me to do both at the same time.
Yeah, that's awesome. That's awesome. That's some great tips for anyone teaching or looking to get into their MPH program. You sound like you're definitely a Excel kind of person. You had that on an Excel spreadsheet, or am I wrong?
Oh yes, even right now I'm planning on applying to DRPH programs. I'm doing the same thing. It helps having a plan or just a visual to kind of help you, So for me, I'm an old school. I like to write things down. I can't do the whole like phone reminder thing. It just doesn't work for me. So,
were there any other schools that you possibly thought of going to?
I did think about going to New York Medical College. I got accepted there as well. However, it was in Westchester, and I'm Caribbean. I don't do the snow. I don't like the snow that well. So it was a great program, but I felt that their concentration was not was something that I thought I would have gained more out of, but I didn't, looking back at it. They have a really good program, but I just didn't think that I was the right fit for it. And I didn't think they were the right fit for me. And also location, Manhattan is closer to New Jersey than Westchester. I think it's in Westchester. They're like further up. Okay. And so I definitely, the location, and Mount Sinai definitely won me over with the flexibility, location, and the concentration. So.
Okay, and that makes sense. That makes sense. So what was your personal passion and desire to go into the concentration of health promotion and disease prevention?
So I think my passion was from the fact that I worked as a research assistant at a nursing home when I was an undergrad. I basically worked with about 6 or 7 residents. They all had chronic diseases. And so one of the parts I worked with some residents were, how do you ask your physician a question, and how do you properly ask them to make sure that they answer it? Because sometimes as a patient, you can go in, doctors, they prescribe you a medication, then you're out the door. You have a whole bunch of questions that you didn't think to ask until it's too late. And so part of my job was to work with residents and even sometimes write them down a list of questions that they should be asking their doctors or their pharmacists, because you want to make sure that the medication you're taking is the right medication, and you want to know how the medication works. Obviously, we're not going to get into detail with the mechanism of action and things like that, but you just want to make sure that, okay, if you have X, Y, and Z disease, if you have blood pressure, this is the medication you should be taking. And also reading the instructions is very important. Some people do not read instructions. So I've had a resident tell me that I just take it whenever I want to. And I've had to coach her on that, the importance of taking the medication in a timely manner. And so that really, that's the disease, health promotion and disease prevention, promoting health, within a specific community or within a specific population. I literally broke the concentration down. It's like I was promoting health, and then there's that disease prevention side, which encompasses public health and what it is, right? Because we're here to prevent diseases in the community through a variety of ways. And so that concentration really stuck out to me, for sure.
Okay, thank you.
All right, that was really long.
It's absolutely fine. I have here that you were in the public health interest group.
Yes, so I actually started that interest group back in 2019, midway through my grad school. And the program existed before, or the interest group existed before, but no one was doing anything with it. It was just a club that was just sitting there. And so I offered to take the initiative to revamp it. And then the good thing about Mount Sinai is, their student council, which I was a part of, they give you money to fund a certain club. So it's not like you have to there are certain fundraisers that has to be done. But there's an X amount of, depending on the activity you want to do in the public health interest group. So one of the activities that I wanted to do was, depending on the type of members we have, there are PhD members, there are other MPH students, there are medical students, and depending on their interests, we would have speakers from different parts of New York City or New York State, depending on where they're located, come in and talk about the work that they're doing, whether it's research, whether it's working with a nonprofit, whether it's serving as a director of some health and wellness program in East Harlem, whatever the case may be. They can come in and talk about the experience, and also allow students to network. Because for me, as a first year MPH student, I even questioned whether or not, I wanted to pursue public health for like 2 seconds, because I got very intimidated by the different kind of work that other students were doing. They have a lot of experience in public health. And for me, I was just like, oh, well, what is the right part of, like, what is my niche? And that's what I wanted the public health interest group to serve as, because I did not want students to feel as though like they were alone. Because the speakers also came a long way. They also had to find their niche. They had to find out what their passion is in public health. And so the interest group served as that purpose.
And yeah, that's awesome to always bring people in and hear stories. I think it's always informative, and it's asking questions sometimes. So that's definitely awesome. I wanted to ask, so how you said that you were intimidated by your other colleagues, by what they were doing, and you weren't sure like what you wanted to do, or you weren't sure how to find your niche. So how did you go about finding your niche in public health?
I would say that I found my niche through my mentor, and Dr. Elizabeth Howell, and also my grad school. What is that thing? Grad school advisor. I'm sorry. Dr. Elizabeth Garland. I worked with Dr. Elizabeth Howell doing maternal and child health research. And, it was nice to have a mentor that looked like you. She was a Black woman, she was Jamaican, and she was doing maternal and child health research, which is something that I want to do in Haiti. My long-term goal is to open up a nonprofit strictly doing maternal and child health, activities or work in Haiti because of the disparities, not just the disparities in the United States. And one of the things I question is like, if maternal and child health is such a big issue in the United States, imagine how it's like in the Caribbean, right? And so that was one of the driving questions for me. And I would say that's how I also found my niche. For me, I have a lot of passions. I'm passionate about a lot of things. and it's hard to narrow it down. Maternal and child health was my first passion. My second passion is infectious disease, which is the work that I do right now. One day, I want to open up a surveillance system to detect infectious disease in Haiti. So that's another thing. And I feel like by having strong mentorship and by, networking with not necessarily people in not necessarily with doctors, but also other students, and hearing the different kind of work they did at different organizations and nonprofits, really helped me because, March of Dimes, like Black Mother Coalitions, like they're these kind of organizations that I personally didn't know about. But working with my mentor and also working with other doctors who are doing, you know, different kind of research on maternal and child health, not necessarily looking at discrimination, but they're looking at postpartum depression. So that's kind of really how I found my niche. And I'm the type of person, I love talking to people. I cannot sit still. Like, I'm a go-getter, and I love networking. I just love getting to know people's experiences and how can I help you and how can you help me, kind of thing. Because for me, mentoring, it's not one way. It should be a two-way relationship. So that was really one of the things that stood out to me and helped me find my niche in public health.
Yeah, and that is awesome. That is awesome insights right there. And I definitely think that mentorship is always like a two-way road, if that makes sense.
Right.
But
Yeah.
it's a give and take. Like you have to give value to get value, and the more
Right.
that you give, the more that you can get. Um, but I wanted to ask you. So you seem like you have like a lot of big dreams, big ideas, big things that you want to do. How did you develop this like mindset to think about these big things or want to do these big things?
Hmm. So I think for me, it was just interning at NYU. My other mentor was also Jamaican. And he has a background in social work. And again, he told me all of his experiences up until now working with New York City Treats Tobacco Department. And I really appreciated that because mentorship is one thing, networking is a different thing, but also just putting yourself out there. I think one of the things that I was scared to do in grad school was taking risks, because I don't like regrets. I don't like putting myself in situations where I feel like I might regret it, but you won't know until you try, right? So that's kind of the mentality that I developed, and I was just like, yeah, I would definitely like to do this. I mean, funding is always an issue in public health, but you have to start somewhere to get somewhere, right? And that's till this day, that's my mindset for opening a nonprofit or for having MCH resources in Haiti, and collaborating with different organizations within the US, because it's never bad to dream big. And as a child of immigrant parents, it's kind of have to, it's I feel like it's a necessity for me personally. And that's been definitely the driving force for how I cultivated, my goals, my long-term goals.
Yeah,
I don't know if I answer your question.
yeah, it does, and I think that's awesome. And because I know a lot of people just struggle with like I feel people just sometimes just focused on like that one thing, or just thinking
Yeah.
too small sometimes. And I feel like it's not to say that a goal is particularly the best thing, but you want to set yourself up to go in a certain path, and then like pivot as you go along and learn, as you did in nursing and you went into public health, and just that similar kind of thought there. So thank you for sharing that.
Yeah, no problem.
You touched on you were health promotion coordinator intern at NYU. So I don't know. Yeah, you did touch on a little bit of what you did. Was there anything else you wanted to add there, or not really?
No, I think so when I was an intern there, that was my first time learning how to do a literature review. Because I was also doing research at Mount Sinai, but also doing a lit review. And, it is a process, but I think my introduction to how to properly conduct the research also started there too, which is why actually when I was looking for my internship, you have to do like an applied practical experience as part of the grad school, like an internship based experience. And for me, I was not necessarily looking to do work in maternal and child health. I was not looking for an organization that did MCH work, because again, as a first year student, it's like like, what am I interested in? I'm learning, I'm taking all of these public health classes, but what is the actual work that I want to do? And New York City Treat Tobacco stood out to me because of my experience working in the pharmacy as a pharmacy tech. And I was like, well, this seems interesting. And I have enough knowledge on different types of medication or smoking cessation medications and techniques that I can definitely apply to this internship. I got in, met the whole, the whole crew and the whole team. And then they explained to me the work that they're doing. And then at the end of the internship, I created a train-the-trainer curriculum that had 12 different types of modules on how to properly train pharmacists to address tobacco history among, or how to how to tell pharmacists or different kind of, not just the pharmacists, but like doctors, the staff, like the receptionists, on how to, deal with patients who have a history of smoking tobacco, like the different types of questions you should be asking, and how to ask questions is important when you're seeing patients. So that was definitely something valuable that I took out of it, because I'm no longer pursuing medical school. But it was something that's good to know, because in the event that I would like to train someone, this would definitely come in handy.
Yeah, absolutely. And I think train the trainer models are really, really essential to like broadband or like widespread access to whatever education. It's a really good way to disseminate information to.
Yes.
And then you were also a clinical research coordinator at the
Yes.
Department of Population Health and Policy.
Yeah, so that was my maternal and child health work. My title was a clinical research coordinator, or a CRC. And it was a lot of not just research, like gathering research, related work, but also one of my best experiences working as a clinical research coordinator was interviewing moms who either, one of my research, or one of the research that I did at Mount Sinai, focused on perceived racial discrimination in Black and Latina moms in the delivery setting. And I had the opportunity to do a focus groups with 7 different moms. You had Black moms, you had Latina moms, and you had Caucasian moms, just to kind of see what were the gaps in healthcare communication or provider communication, and also were there racism. We hear about it all the time, not just in maternal and child health, but in different fields of public health. And it was very an emotional thing for me, because hearing the kind of traumatic experiences these moms went, and it was very rewarding, but also definitely emotional. It was a very sensitive topic, and I appreciate having that bond with the mom and just hearing, from their perspective what happened. And as a public health professional, what can I do as a Black woman, not just as a public health professional, to prevent these things from happening to, at a leadership level. And so those are the kind of experiences I had. I enjoyed, doing the focus groups, doing the interviews, and just learning about the women's experiences.
Yeah, and that seems like really meaningful work. Did you have to create the focus group questions that you asked?
So the focus group, yeah. So the PI and I did create the focus group questions. A lot of that, we had to do a little bit of research just to make sure that we were asking the right questions and we were capturing the right information. Because sometimes people will answer questions and, what do you get out of it? There's no information. And, we included some probe, just to kind of get a little bit more information out of them. And they're very open. Sometimes we wouldn't even need to probe. They would just like tell us all the information. Sometimes they would include names. So it's very, it was a process, but it was a well thought out process. And I definitely, one of the things I can confidently say and even get out of this experience is I feel very comfortable creating a focus group questionnaire, geared towards whatever the topic is, because of that experience. Yeah.
Yeah, valuable experience. Did you also code the responses?
Yes, we used a software, a qualitative software called the Deuce, to kind of, code all of the quotes, all of the information that we gathered. We did blind coding as well. It was a very long process, but it was definitely worth it. Just the beauty of seeing it all, come together. It's just amazing. And then we did send the moms, a thank you letter. If they have any questions, they can reach us. Yeah, so it was a very thoughtful but definitely informative experience for me, because I'd never had a background in MCH before until now.
Yeah, that's awesome. And I think coding could take qualitative data
Oh,
research to another level sometimes, although it is very time consuming, and
yeah.
you need like capacity to do that kind of work.
Yes, absolutely.
Yeah. So is there anything else that you learned throughout your Masters of Public Health program that you wanted to share?
Um, let me see. I would say, like, about me, or just in general.
Either or, both if you want, whatever.
I would say, like, for people who are thinking about getting their MPH, definitely do your research, because some programs do not do a very good job at promoting themselves. They do not give themselves more credit. And I feel like, that's something they need to work on their end, but also feel like people shouldn't feel scared to ask around, because really, if I hadn't asked a medical student, because she was also getting her MPH, about my Mount Sinai's program, I would have never learned about it. And so I definitely, I mean, I enjoyed my experience at at grad school. But for people, I would say, like, don't be afraid to reach out to the faculties, the people who are actually teaching in the program, even though you don't know if the program is right for you. I mean, like, you need the information. You need to know what's the best, concentration, what's the best degree for you. I was one of those people, like, I feel like if I put myself out there, like, they'll yell at me, they'll send me a nasty email, but it's like, you have to take the risk, like, you won't know until you try. That's just kind of the saying. But my overall experience in Mount Sinai was amazing. Till this day, I still speak to my mentor. When I was doing my thesis, which was on prostate cancer, examining the barriers of prostate cancer, I spoke to a lot of surgeons, radiation oncologists, urologists, about their experience, diagnosing men with prostate cancer. And the other part of that study is also looking at the experience from the men's side, like, did you feel comfortable, with your doctor? Did you feel like your doctor answered all the questions? See how all these questions overlap from maternal and child health to prostate cancer. Because essentially we're trying to get the same information, but it's two different issues going on, overdiagnosing, underdiagnosing, you're not listening to me, you're not believing me, like, just these kind of issues that overlap with one another, but it's just two different populations that's being affected. So, yeah.
Yeah, that's key insights, and that's intersectionality right there.
Yes.
Awesome. So you graduated from your MPH, and then you became a CDC public health advisor. So
Yeah.
tell me the thought process for applying to the CDC, or just jobs coming out of your master's program.
So one of the concerns I had when I was graduating from my MPH program, which I feel like most people do, is, okay, what's the next step? Am I going to get a job? Like, someone has to pay these loans. Literally, that was my thought process, like, applying to jobs. And so I applied to New York City Department of Public Health. I was applying to a lot of jobs. And I would strongly recommend people not to wait until graduation, to apply at least 3 to 6 months before you graduate, because it takes a very long time to hear back. Yes. Well, yeah, 6 months. And so I was just, constantly applying. I was also talking to my advisor, asking for her feedback. I was talking to a lot of people, and I was sending out my resumes to different departments, like departments that I knew that I wanted to work in and I wanted to do research in. But there's also that part of me that's kind of desperate to get a job, even if it's not something that I want to do. But again, you have to take the risk. So the Career Center at Mount Sinai sent out a list of fellowships, CDC, and I applied to it. I was like, listen, what's the worst they can say? No, right? So I applied, and one of the things that I was kind of hesitant about applying to is because they literally put you anywhere in the state. And I knew for a fact I didn't want to leave New Jersey, New York. I didn't mind going to Connecticut. So one of the best things about the fellowship is they actually ask you where you would be comfortable going to. So I put the three states that I was, or the states that I was comfortable going to, and it took about, I would say, 6 to 7 months to hear back. And that's very stressful. And so it all worked out. I'm a spiritual person. I'm just like, Jesus, like whatever you give me, I'll take it at this point. It's all in your hands. And so I heard back, I went through the interview. The interview process was amazing. The person who interviewed me, it's like, we just bonded, and so I knew for a fact I got the fellowship if I made her laugh a lot. So that was like one thing that I was like, okay, cool. So it worked out. And my experience working as the fellowship is called Public Health Associate Program. And it's a 2-year paid training program with CDC where they assign you to either different public health agencies or non-governmental organizations. And it's for 2 years, and you work with other public health professionals across the country and within the country in different public health settings. And so I was assigned to the Connecticut Department of Public Health, specifically in the Healthcare Associated Infections and Antimicrobial Resistance Program, HAIAR, which I like to say. And my work so far has been, it was a lot. And it's a good a lot. And so before COVID, I was, working with different types of outbreaks, looking at MRSA, C. diff, different types of, MDROs in hospital settings. And then COVID happened because COVID. And so then it was kind of all hands on deck. And then from then on, I've been doing COVID work since. I work a lot with nursing homes, assisted living facilities, local health departments, hospitals, providing them with infection control guidance. Sometimes, if they need assistance reading, CDC guidance, I'm here to help them interpret them and just kind of, give them enough information so that they can make a decision for their facility. Because we're not here to tell them what to do. We can give recommendations and, suggestions or requirements, or, obviously there are mandates, but it's all up to them to kind of absorb the information and make a decision that's best for your facility. And then the other thing that I do is I also do vaping case investigations at the state health department, and different types of outbreaks. My experience as a PHAP definitely helped shaped and paved one of the reasons why I want to get my DRPH and my long-term goals as well. I've enjoyed it. So PHAP, go PHAP.
So you're still in the PHAP program then?
Yes. My PHAP, my fellowship ends in technically October of this year. And I'm in the process of applying for jobs, whether it's working as an IP, infection preventionist, or doing research on infectious disease. I would ideally like to continue doing the work that I'm doing with COVID, because I've enjoyed every part of it, or maternal and child health or cancer. That's pretty much what I've narrowed it to so far. Okay. There's more, but yeah.
So what's the process like synthesizing COVID health guidelines that you disseminate into these different stakeholders? What's that process like on your side?
So I think for me, my process, it involves rereading a lot of what's on the CDC website, because you're not going to get what they say the first time. And for me, if I have different nursing homes calling me and asking me, hey, I know CDC's website says this, but the state health department says this, can you confirm or clarify which one is the right guidance? And a lot of our guidances are based on the CDC website, which kind of helps us form our guidances as well on a state level. And so the process definitely involves reading, bouncing ideas off of coworkers as well, just to make sure that the message we're providing the nursing homes are accurate and they align with what we are, with what they're also reading. Highlighting, I'm very big into picking things apart because I want to make sure that if I'm telling you something, it's going to make sense. And I don't want people saying, oh, you're giving me the wrong message, or, people are quick to say that. So I'm very cautious, and I'm very, it's a tedious process for me, but it also helps me understand what's happening. And that way, if I ever get a call, I know what to say. And if I, if I don't know the answer to their question, I can always go back to my supervisor or my colleagues and work as a team and say, hey, we have this very important question that I don't know the answer to. What do you guys think? So that's been the process so far.
Yeah, and that's good information for any job. Like if you don't know, go and ask someone and get that information.
Absolutely.
So I know that you've been stationed like in a couple different places. How does that work?
So the deployments that CDC they assign you, most of them are remote. Like my next deployment is remote. I'll actually be working with the vaccination team task force starting in May. Because of COVID, it's best to have the the deployments virtual. But one of the things that I will be doing is really assisting and serving as a point of contact for different jurisdictions. I don't know exactly what I'll be doing as far as like, being on calls and the meetings and stuff. That actually has yet to be determined. But I know I'll be working with different states, different stakeholders, and just working with different leadership folks at CDC on the vaccination team task force. But a lot of their deployments are remote. And there are deployments that actually they send you out to different states depending on the needs of the state. So.
Okay. And how do you integrate yourself into those new teams? Because it seems like you're going in, you're jumping into a completely new environment. Yeah. So how do you go about like integrating yourself and being most effective as you jump into it?
I think a lot of that has to do with shadowing. So one of the things that I do when I'm first deployed is I introduce myself. I'm a 2019 PHAP and I'm an associate. I work with the Connecticut Department of Public Health in the HAIAR program. And I mean, I'm just here to learn, shadow, and kind of help and assist the team with whatever they need help doing. And also, this is a learning experience for me, and I'm also meeting new people. So I think I integrate myself in different ways. I'm the type of person I really like asking questions because there's also that perfectionist side of me where I don't like getting things wrong the first time. And I'm very big into, can you explain this to me again? If someone has to explain something to me twice, that's fine, because I just want to make sure I'm providing you with the information. If whatever you need, that's right. So that's pretty much how I do. I'm more of a fly on the wall when deployments start. I just want to make sure that I get the gist of it. If someone needs me to do something, I'm here. And I just ask questions. That's really the basis for me.
What is the least and most exciting part of this role?
The most exciting part is working with people. The least exciting part is working with people.
Feel you.
If that makes sense. If that makes sense. Because there are in this role, there are different personalities that you will encounter, and very abrasive personalities and personalities that you're probably not used to working. But I think for me, I get along with everyone. I get to know people before I say anything, I do anything, or I ask questions, because you don't want to come off as offensive or rude or insulting. But for me, I definitely enjoyed learning from people, but there are also different type of people that some people listen, like they don't listen at all. That's just one thing. They just listen to respond, but don't listen to understand. And those are the type of people that I often struggle with. And it's getting better. It just needs a little bit more practice. In a certain type of tone you have to use with these kind of people, because you don't want to seem like a know-it-all. You don't want to seem like, oh, whatever you're saying is right and they should just take it. Even questions related to vaccine efficacy, related to COVID, related to traveling, just any questions really related within COVID or without COVID. I just try to make it as exciting conversation as I can. given how problematic sometimes it can be. There are people with very forceful personality, a very strong personality, and it takes time to train yourself to get used to that. But it's all part of the job, the job comes with surprises, so you just got to take them as they go.
Yeah, and definitely people are people, you
Yeah,
never know, you never know what you're gonna
exactly.
get. So I definitely feel you, feel you there.
Right.
So where do you want to see yourself in the future? I know you spoke about your nonprofit around maternal and child health, and you also spoke about a surveillance business. Is there anything else that you see in the lights, or anything that you wanna just share that you want to do?
I'd like to teach. Part of the reasons why I would like to get my doctoral degree, is to teach abroad. Because I feel like there are other countries that would benefit from the kind of knowledge that people are learning within the U.S. Given that they don't even have the infrastructure, the resources, or the people, to learn these kind of information from. And so I want to serve as that kind of person. I want to be the point of contact for, I don't know, maternal child health in Haiti or in Ghana or Nigeria or Jamaica. Just doing the kind of work within the community, not so much at sitting in a hospital in an office just typing stuff up. Like I see myself in a community, talking to people, getting to know them, because really, if you're not in the community, how else can you gain their trust, right? And you have to listen to people, get their narrative. I have been able to talk to people or explain information to people through storytelling. And that's something I actually just started learning about. And I like the concept of storytelling. And it's actually I feel like it's more impactful than anything. And so that's my approach to a lot of the work that I would like to do in public health, once I get my DRPH.
Okay.
Among other things, I have other goals, but that's just the top two right now.
Well, thank you for sharing. Tell me more about the thought process for wanting to get your DRPH.
So I'm actually planning on hosting a session with Dr. Hope King,
Okay.
about a DRPH versus PhD. I can send you that information once it's finalized. And basically, I ruled out PhD for a variety of reasons, and the amount of time was also a factor. Funding, yeah, you can get your PhD funding, but a DRPH, to me, I want to do a lot of leadership work. Because I want to be in the community, I can definitely serve as a leader for a community. And that's really where the DRPH degree comes from, or my decision to pursue a DRPH. Because if I want to build a nonprofit one day, I mean, I don't necessarily have to be the leader, but being on a board and just speaking and advocating for community, it just gives me the satisfaction, especially for those who are unable to advocate for themselves. And I know some people would say that, you don't necessarily need to be a leader to do that. But I feel like, given the, what do I say, the kind of society we're in, it would definitely help having that leadership role, serving multiple communities, serving multiple populations, and just making sure that the community get the resources they need. And yeah, and then also there's a time frame. Some DRPH degrees take about 3 to 4 years, and that's better compared to 6, 7, possibly 8 years, because I have a lot of goals set out, and I'm a planner. I like to plan stuff out, even though sometimes it doesn't always go well, but that's okay. Take it as they go. So yeah, that's my thought process. If I
Okay.
answer the question.
Yeah, awesome. And yeah, definitely share the session with Hope King, Dr. Hope King, and I will pass that on to everyone else so they can check it out as well. And yeah, I love that thought process. I was actually talking to someone yesterday about actually DRPH versus PhD.
Yeah.
Same, very similar reasons to you. And I feel
Mhm.
like it's just more leadership, management, practitioner focused,
Right.
as
Exactly.
opposed to getting like really knowledgeable in this one thing or having these specific like research skills.
Exactly. Yeah. Yep.
Yeah, so tell me more about, you said that you're leading that storytelling is like an important part of like learning, teaching, and I also think so too. And I'm trying to learn myself how to become a better storyteller. So tell me a little bit more about that.
I think for me, when I go about storytelling, you have to kind of have a certain demeanor, and not, I don't know if you're in Clubhouse, but they use a lot of energy and vibe, and
Mhm.
so there's this particular energy that I feel like some people naturally have, and some people they have to train themselves to have that. And I, when I tell people, or when I tell people about myself, they automatically have they open up. I don't have to ask them to open up. And for me, it's like, I'm telling you my story. I'm telling you about my, my life, and just putting people in a situation where they are okay with being vulnerable. To me, that's beautiful, because I don't necessarily have to pry. I don't necessarily have to force information out of you. It just flows out naturally and it's organic. Um, and one of the things I do with storytelling is I usually am the first to talk. I don't ask questions right away, because I want people to know that I'm putting myself in a vulnerable situation as well. And it's okay if you want to as well, but you don't have to. So you gotta have to give people that option. And the storytelling thing, I was thinking about it the other day, and it really came out to the whole focus group. Because one mom, she was ready. She was like, I got the information you need. I got names. What do you want? Da, 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 da. And so I was just like, oh, wow. Like, and then I felt more comfortable. Like, even after the session, like, I just kind of spoke to her about, as a Black woman, like, I'm scared to have kids if this is the kind of traumatic experiences that, we women go through. And she was giving me all sorts of advice, and she has a daughter my age, and she was just like amazing about it. And then I was just like, well, if she put herself in a situation where, people can easily judge her just based off her experiences, and they could be like, well, why didn't you do this? Why didn't you do that? That's not the kind of approach I want. Especially when you're trying to gain the trust of these women. They took their time out of their day to come talk to you and tell you about their experiences. So the least you can do is hear them out. And also, like, you don't have to be very, like, you don't have, like, you just have to match the energy that's kind of in the room, and you can easily read people's body languages. That's one of the things I've picked up on. Reading people's body languages doing focus groups says a lot about the trajectory or how the focus group is going to go, and that's very important. And I've been able to kind of incorporate that in storytelling. If I'm crossing my R's, if I'm not looking at you making eye contact, then obviously I'm not interested. But I don't know. There's just so much to storytelling that I feel like it should just be the idea that everyone just go for it. Like, just train yourself to do it. It's a lot of work. It's something there are some parts I struggle with. Like, for example, ask like knowing what kind of questions to ask. Because I don't want to ask it in an offensive way. But yeah, that's it's a work in progress for sure.
Okay,
So
awesome. Yeah, and thanks for sharing that. I think like a lot of things in life is a work in progress.
right,
And
right,
and there's always value in learning whatever, like sharing whatever little we learn, because you never know how impactful that might be to someone else. So
right.
definitely just share everything that you do know. And moving on to the moving on to the last five questions I ask every guest. So number one, what advice would you give to a student trying to pursue a career in public health?
My advice would be, one, do not limit yourself. Just because you have an experience in one thing doesn't mean you can't have experience in another thing. Um, my second advice is definitely take risk, calculative risk. Even if it comes to finding the right program for you, deciding where you want to move. Like, there are so many things that factor in when you're getting your MPH. And definitely reach out to the faculties, because some faculties are very open to discussing the program and the kind of work that they are currently working on. And some surprisingly, some faculties will look at your personal statement for you if you are interested in their program. I've had that happen to me. I've had someone look over my resume and my personal statement, and given me tons of feedback, because they understand how stressful it is to find the right program that works for you and how costly it can be. So definitely those are my top three. Do not limit yourself, put yourself out there and take risk and reach out to faculty members.
Yeah, that's awesome. I've never heard that before. So thank you for sharing that advice.
No, no problem. You get lucky.
Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
So in addition to the advice that I gave prior, just apply it to the different types of job markets. I know CDC has very specific, criteria and requirements. Take a good look at the criteria and requirements. Don't apply to a position that you don't qualify for. Especially if they ask for you to have an MPH, don't apply if you have a bachelor's, so those kind of things. But also when I say take risk, definitely apply. CDC has tons of fellowships. PHAP is one of them. ORISE is another one. CSTE is another one. Keep applying. Definitely keep applying. And don't hesitate to reach out to other fellows, because these fellowships, often they have current fellows on their website, and also LinkedIn. I've been able to connect with a lot of CDC fellows on LinkedIn just to talk to them about their experience. What's the most exciting part or the least exciting part or the most challenging part about being a fellow in ORISE or CSTE. And I also did the same thing with PHAP before applying. I spoke to at least 5 associates who were in the program, who were in the program, and who also graduated and who are currently in the program. And they were able to tell me about their experiences and, why they chose PHAP as to be their fellowship. Yeah, I think that's, I feel like I have more. Yeah, it's really, don't limit yourself. Like, just take risk, just because you have a background in maternal and child health doesn't mean you can't do adolescent health, like everything. Like, do not be afraid to take risks, but also have faith that everything will align, and it all makes sense in the end. You'll be like, oh, that's why, but yeah, that's what I have to say.
Awesome. Number three, what's something you're working on improving in your life right now?
Professional or personal?
Either or, both, whichever one.
I think personally, I've been going to the gym more, like 3 times a week, which is awesome. Professionally, I think I need to be more confident, because I tend to second guess myself. Like, I know the answer, but then I don't necessarily have to go to a colleague, but I feel like having to go to a colleague, it kind of gives me that satisfaction that, oh, I'm right. But if I hadn't gone to her, I would have had the same satisfaction, if that makes sense. So I'm training myself to not go to people when I'm confident that I know it. But there's also that part of me that I do not like giving people the wrong information. So I always feel the need to ask. But there's also that part where you know the information, so you don't need to go to your colleague to get that confirmation.
Yeah, fair enough. A little bit of imposter syndrome in there, maybe.
Yeah.
Number 4, professionally, do you recommend anything?
Anything as far as?
It could be a book, a podcast, an association, just
well,
advice.
definitely your podcast as one. Definitely reading. I am trying to do a lot of reading about, like, in documentaries. I'm trying to get into meditating. I feel like I don't have the patience to meditate, but that defeats the purpose of meditating. So I'm trying to work on that. And then just kind of finding out different ways to improve your skills yourself. I've done tons of free trainings, John Hopkins courses, Coursera.com or .org. Just finding the different types of available and free resources that you can do. But obviously there's personal time. Take some personal time to yourself and find out, what do you like to do for self-care? Do you like going hiking like me? Do you like, I don't know, volunteering, or just doing something that gives you that peace of mind, so that way the next day you can go back to work feeling calm and not have to stress. So, but I'm open. I don't know much about podcasts because I listen to music a lot and I dance a lot, but feel free to recommend me some podcasts, Omari, because I definitely need that.
Yeah, you definitely let me know afterwards and I could tell you about a couple maybe. And then last but not least, where can people connect with you?
People can connect with me on Twitter, my first and last name. They can connect with me on LinkedIn, my first and last name, or Clubhouse, my first and last name.
Awesome. Well, thank you so much for coming on the podcast today and sharing your story and your insights. I greatly appreciate it.
Thank you so much for having me. Appreciate it.
Yeah, my pleasure. Well, I'm glad to finally get Naissa on the podcast. It's been a couple months since I've been trying to get her on. No hard feelings. I know that she's been moving around the country doing different assignments and different public health work. So thank you, Naissa, for that work that you've been doing. And thank you for making time to be on the podcast today. I appreciate your insights. And I know everyone loved to hear your story. So thank you. But definitely review, subscribe, leave a like, share this with a friend. I greatly appreciate you, and it would help this show get out to more people. And that's definitely what I'm trying to do, just get it out to more people, help more people navigate their path, their career, their story in public health. So if you can just subscribe or like or share this with a friend, I would appreciate that a lot, and that helps me a lot. So yeah, see you all next week. Public Health Millennial out.